Good night. My name is Grace. I am a nursing student. I am in my second semester in the nursing program. So, tonight I will be talking to you about how to assess your levels of cultural competence using the staircase model. So, in 2010, volume 46 of the Perspectives to Psychiatric, the authors identify that research has reported that nurses believe that they are not confident and adequately prepared to provide cultural competent care to their patients. So, in order to prevent those of us who are nursing students to feel the same inadequacies, I will be discussing how to how to assess yourself and also give you some solutions of what you can do to achieve cultural competence. So why is the staircase model important? So as a nurse, and you're in your field working, you're going to come across different people from various cultural backgrounds. And you're going to be able to have to identify potential problems as well as actual problems, as well as come up with solutions to help you resolve these problems in regards to culture and cultural issues. In the book, Delivering Cultural Competent Nursing Care, written in 2013 by Kenzie Mutasiak, the author highlights the staircase model as a tool to assist students and practicing nurses to assess their personal level and degree of cultural competency. So now, let's imagine that you were a patient. You're from a different country, you speak a different language, you are you have a different religion and also different cultural values from the norm. And you're admitted to this hospital or institution, and your nurse did not take the time out to get to know you, to get to know your likes, to get to know your dislikes, ask you about your preferences. I would assume that this will cause a lot of conflict. For example, one, you might have a language barrier. Two, you might get a plate of food with an article of food that you did not identify, or you didn't eat, or you don't eat, or you may have a treatment plan um, that is not conducive or suitable for your when it comes to your cultural values or views. So this may cause a lot of frustration. This may cause you to have conflict. This may cause you to repeat yourself a lot to the nurses. Just it can go on and on. All the different things that you might feel, all the different things that you might experience, and all the different conflicts that may arise. So there are 6 levels in to be cultural competent. So the staircase model now, it's like it's for example, it's just like a stair. the concept is just like a stair. You can a person can ascend as well as descend, which signifies that cultural competence is ongoing and is also a lifelong experience. So that is what that symbolizes. So in level one, I just wanted to just minus this a little bit so that I could okay, pull this up 1 minute. So just give me 1 moment, please. So in level one, I have a little in the continual of cultural competency at the stair one. Level one is known as cultural destructiveness, and I will discuss it more in depth. Level two is known as cultural incapacity. Level three, cultural blindness. Level four, cultural precompetence. And level five, cultural competence. And level six, cultural proficiency. And I'm going to try to see if I can insert this in the video, and if not, I will have to put my graphics down at the bottom, but I'll see if I can insert it so that you can see what I was reading from. So at level one, the nurse fails to recognize the importance of the influence of culture on health care. So, for example, how would you identify a nurse like this? So, perhaps in this example, the nurse graduated from nursing school before the concept of cultural competence was introduced. And so the behavior of this nurse, their plan of care or their care plan is a one size fits all. So put to they would not consider cultural as their culture when they're planning their care, or consider the personal preferences or values in that sense. At level two, the nurse has a growing awareness of influence of health on culture. Has an influence of health of culture on health when it comes to health, but limited self-awareness and knowledge of other cultures. So at level two, this nurse would be a determined nurse someone who is willing to learn. They want to read books. They go and they do their research on the web, just trying to gain the knowledge that they need. And then to solve this problem, they would go out and they would interact with people from different cultures so that they can gain the experience and knowledge of that culture. And also with the nurses at level one of the ways that they can solve that condition is that they could first begin to learn about their own culture, and then they can go out and learn about other cultures. So start with your own culture for the nurse at level one. Now, at level three, the nurse began to develop cultural awareness, acquire cultural knowledge about one or two diverse groups, and also includes it in the plan of care consistently. So, for example, this nurse would only focus on the culture that he or she has learned about, and incorporate cultural aspects to those people or those patients, but omit or overlook other cultures that they don't know about, that he or she does not know about. So in order to solve this problem, even if you don't, as a nurse, even if you don't know about um, different cultures, or you just know about one or two culture, what you should always try to incorporate culture, consider culture when planning care. And you can also ask the patient, you can ask them open-ended questions so that you can get to know them, you can get to know their likes, you can get to know their dislikes, you can get to know their preferences and values that are important, especially when it comes to making health decisions, or if especially when it's related to their health care. You want to gather those information. Now, in level 4, the nurse has a strong cultural self-awareness and readily apply cultural knowledge to care plan. So for this nurse has done their research. They now have social networks that they know exactly where they need to go to. They have resources that they can go to learn about the cultural groups. They know how to identify who on the job that is cultural competent that can assist them, so they know exactly where they can go to get help. So although this nurse is at a good place, this nurse still needs to expand his or her knowledge. He or she is not yet fully competent. So at level 5, the nurse in this category is highly aware and readily apply cultural knowledge to care plan. So, for example, this nurse can be used as a point of reference. They can be a coach or a mentor or a role model to other nurses in helping them to delivering competent care. At level 6, which is the final step, the nurse has attained a high level of self-awareness and a broad knowledge of one or multiple cultures and has ability to solve a cross-cultural group. This nurse can identify areas of diversity in which nursing need further development. So this nurse would serve as a teacher, as a professor, as mentors. They can also publish their own publications, and these type of nurses also do research. And the solution for this nurse, although they are proficient in what they're doing, they have a broad knowledge and understanding, you know, they still have to continue to gain knowledge as well, especially in the areas that needs development. And also the nurses in level 4 and level 5, they they need to continue their education. They need to continue learning. They can go to like workshops. They can go to find different things and places and group gathering where they can learn and become more competent. They can also continue utilizing the web, reading books or whatever it takes to help them to interact with other cultural groups so that they can gain the training and the experience that they need in order to become cultural competent. more cultural competent. So these 6 levels can help you identify where you are. It also provides helpful solutions at each level of the assessment. This assessment is not only effective, but can serve as a means to motivate you to get the right training, to take the appropriate steps, by gaining the experience you need so that you can become a more proficient nurse in providing and delivering satisfactory care to your patient. And that is all for now. I hope you've learned something that you can take with you and realize that the importance of being culturally competent, the importance of applying culture, considering a patient's culture whenever you're planning care, and do it consistently. Don't be like a level two nurse who just applied inconsistently sometimes. But although you may just know one or two, you want to try to incorporate culture in all of your care plans to your patients. And that's it for today. Have a good day. Bye.